Great. Thanks for having me. My name is Annalisa Hultberg, and I'm an extension educator at the university. I work, back when we had offices, I worked out of the Dakota County office in Farmington. But I'm a statewide educator in food safety. So I work with farmers and gardeners, but primarily farmers on food safety. So I work with them on how to reduce the potential for contamination of their fresh fruits and vegetables. I've done, over the last many months, I've kind of taken on COVID as a part of my work, even though COVID is not a foodborne illness per se. It is an illness that impacts farmers and gardeners just like foodborne illnesses in the past might have been. So generally my job would be teaching farmers and gardeners about good agricultural practices, hand washing, avoiding cross-contamination through cleaning and sanitizing food contact surfaces, using water correctly, potable water, getting your water tested, safe use of manure. These reduce the potential of foodborne illnesses such as E. coli, salmonella, listeria, these things that can make us ill. Often these have gastrointestinal issues. And COVID, we know, is not a gastrointestinal issue, it's a respiratory illness. So it actually acts very different than the other kind of illnesses that I spend my time talking about. So we just got done hearing about how we're not in the garden and we might not be for a while. So I guess take everything that I'm saying, thinking about when you do return to the garden. I don't actually know anything about the restrictions or what is allowed or required. These are simply best practices based in science. That's my job, to communicate that science to farmers, gardeners. So I'm going to share with you what epidemiologists and other public health experts have been sharing with all of us to ensure that when we are in the garden, we're going to do the most important things to reduce the potential of spreading COVID. So I will go ahead and share my screen here. Okay. So again, we might not be in the garden now, but we are thinking about when we do return, what are those best practices? So what we know about the disease, it is a respiratory disease. It is not gastrointestinal. Nausea, vomiting, diarrhea are not the primary symptoms. It's respiratory, it's coughing, it's in our lungs. Another thing that is noteworthy, that many of you probably already know this, but it bears repeating, that it has not been traced back to food. It is not a foodborne illness. And as of right now, no public health authority have said there's any evidence that anybody has been sickened by eating food or food packaging. You might have seen very recently, as in like 3 days ago, something came out of Beijing where they said that there was something traced back to seafood. That's been pretty debunked. It is not present on the food itself. So this is a workforce, personnel, and person-to-person issue that we're dealing with here. And something worth noting, for those of us that are interested, it is a lipid-enveloped virus. Now this means that it has this fatty coating around it, which actually makes it more unstable in the environment. It's not very stable. If you've ever had norovirus, which is that gross, you throw up and you have diarrhea for 24 hours, the cruise ship illness, that is very stable in the environment, and it does not have a lipid envelope. It can live on a surface for 2 weeks, norovirus can. This virus is not very stable, and it dries out very quickly on surfaces, and with any sort of sanitizer, basic sanitizing and soap and water, it is rendered ineffective, and it can't be transferred between people and sicken people. So that's a good thing. That's one good thing. I'm not at all saying that it is not very deadly once we get it. It's very contagious between people, but it's not very stable on surfaces. So just so we're all on the same page here, our goal here, the reason why we're not in person is that our healthcare industry is really passionately asking us to flatten the curve, to not have everyone go into our medical facilities at the same time. Minnesota has been a leader here because of we have a big emphasis on public health, and we've been very good about keeping our distance from each other and wearing our masks. So we have to keep that up. We do know, like I said, it's respiratory, so it's spread through primarily that the top, those 3 bullets there, that top bullet is by far the most important way that it spreads. So droplets, literally mucus that is sprayed from mouths and nose when people breathe, sneeze, cough, especially when they do that with some force. Shouting, singing, talking loudly, those things are known to spread droplets more. If you're infected, those droplets can have the viral particles in it that can make you sick. There's also in hospitals kind of this aerosolized, they're much smaller particles and they hang out in the air like a gas for a long time, days. Those happen like during intubation and other procedures, primarily in the hospital. It's not thought to be the primary way that it's spread. And then we have surface, those fomites, which is a fancy way to say just the surface, like a gate or a doorknob or something. Also possible, but not thought to be the primary way it's spread. Still important to wash your hands and sanitize surfaces, but keeping apart from each other is most important. So that top picture there, that close contact, is the majority of cases are traced back to that. And they have they're doing these trace back, these contact studies to say when people are together, you know, you hear about the choirs that are getting together and these indoor things. That's when people get sick. Outdoor is much less likely, though not impossible. If you're close together in outdoor settings, you absolutely can transmit the virus. But has been shown that indoor, close person to person is by far the riskiest scenario there. So this is just to say it again, it's those droplets that are spread and they're sneezed and they're breathed and then they're inhaled by someone else. So focusing efforts really on keeping people apart, and then your kind of surface cleanliness would be farther down the list, but still important. So some people say, how long can it last on surfaces? We do not have much evidence here, much science yet, but we do know they put so this was in lab conditions, they put a lot of the viral particles on surfaces, stainless steel and plastic. The virus was shown to persist for perhaps up to 3 days. Now, that being said, those viral particles that remained at the end of those 3 days likely were not able to get someone sick. So I want you to take that with a grain of salt and say there was evidence of the virus on there. The virus probably is not going to be able to live that long on a surface. But just so you know, I'm putting this in perspective because I know people personally who are taking their groceries in and sanitizing them and spraying bleach on their food and doing things that actually could make you sick. So the surfaces of things, food itself, not likely to get you sick. Standing next to someone, either outdoor or indoor, who is sick and having them breathe on you could definitely get you sick. I want to be clear that things like good agricultural practices in the garden, if you're doing those things, keep on doing those things, even though I know we're not in the garden right now, but keep on washing our hands, keep on getting our water tested. A lot of those things go hand in hand with COVID precautions. So the most important things we can do in the garden to prevent the spread of the illness are: don't come in when you're sick, keep your distance from people, really doing your best to keep at least 6 feet. Now that 6 feet is based in science. That's how far the droplets in general are going to spread. They could spread farther and they could spread shorter, but on average, they've figured that's a good distance. Washing your hands when you get to the garden. If you've carried something in on your hands, washing your hands is always a good idea. It's good for many reasons as well. If you have any other contaminants on your hands, there's still a lot of other things that can get us sick. Washing your hands is going to help. Try your best to not touch your hands, nose, or mouth, because if you're in the garden or even if you're at the grocery store or something, if you've gotten something on that cart onto your hands, if it's just on your hands, it's not going to get you sick. It can only get you, it can't absorb through your hands. It has to get into your mucous membranes. So keep your hands down as best you can. Clean and sanitize those often touch surfaces, those high touch surfaces. So I have another slide on that. Use signs to remind people of your policies. I know there's a lot of people moving through gardens, so signs are really a great way. The CDC has really nice signs. They're available in lots of languages, and they're available for a free download and print. Reminding people not to come in when they're sick. Physical distancing, this is something that you're just going to have to plan on how to do. So minimizing those face-to-face, having the Zoom meetings, have this meeting on Zoom is a great idea as opposed to in person, because it's possible. If there's things that have to be done in person, like literally weeding and planting the garden, well then do that. But try to have shifts, try to have it so people aren't there, many people aren't there at the same time. Unfortunately, you know, try to not have the parties and the festivals and the picnics. It's just not the year for this. I mean, the state fair was canceled. It's just, that's just how it's going to have to go. Some ideas from other gardens. We heard that bottom left is a picture of like a grid, basically. So you assign plots. You're an orange, you're a blue, you're a white, you're a green. So then everybody, it's clear that orange gets to come on Monday, somebody gets to come on Tuesday. I totally understand that that could be challenging. If it rains on Monday, orange is mad that they couldn't come in, these kind of things. I understand this is not a perfect system, but it might be an option for you. Don't come to work, don't come into the garden if you're sick. So this is very important, where we've all had this kind of where someone's asking us questions, this health screening. This would be a really important thing to communicate to everybody in the garden, that they're not coming to the garden if they've had any of these symptoms. This is one of the most important things you can do, because there are these asymptomatic spreaders. I could have it right now, even though I have no symptoms. It's possible. I can't, that's why I wear a mask when I'm in public. But if you do have symptoms, you certainly should not be in the garden. Hand washing is very important. Have hand washing available, and that's very important for many things. If you encounter some rabbit poop, and dig it up. If you cough into your hands, for many reasons, it's important that you're able to wash your hands when you're harvesting food for someone. Sanitizers work against COVID, I want to be clear, but they also don't work in the presence of soil. So if my hands are really dirty, which they often are when I'm in my garden, I wouldn't put a sanitizer on there, because that sanitizer will just sit on the surface of that soil, of any sort of soil. It can be even a minimal amount on my hands, even the grease on hands, and it really isn't that effective. So if sanitizer is meant to be used on really clean hands in a doctor's office. In a grocery store, maybe it's okay to use, because your hands are probably pretty clean when you're in the grocery store. So have it available if you want, but it really doesn't replace hand washing. Gloves also, if you do want to use gloves, that's okay, but they are meant to be used after you have washed your hands. If you come in with dirty hands, put on gloves, and then start touching things, you can spread contamination with a gloved hand just as much as you can with a washed hand, with a bare hand. So gloves don't afford that much protection. They protect you. Like, I certainly like to harvest some, you know, cucumbers or something with a glove, but don't think of it in terms of that much protection from spreading the illness. Better to just have washed bare hands, in my opinion. The nice thing about gloves is sometimes they remind me not to touch my face. Hand washing options here on the right, you see that water, that is a free flowing water. That's a nice design there. That's just a 7-gallon tank you can get on Amazon or Menards. You can put, we have designs for this table, but you don't have to have that table. You could just have it on any table. You could have it on the back of a pickup. You could have it anywhere. The one on the left has that, the spigot that you have to press. That's a little awkward, because how do you wash your hands with one hand? You can't very well. And those are paper towels in the drawer there. And there's a bucket to catch the water. You don't want water splashing all over. It's really best to just catch the water, put the water on some grass or the base of a tree. I wouldn't put it right onto my vegetables. It's not worth the risk, but on some non-edibles is just fine. Oops. We have a stand, a fact sheet on how to build that stand, if that's something that you would want to do. On the bottom left is just another picture of a setup at a table. That's at a farmer's market, but so you can see it's just a table, nothing fancy. So these are the things that the hand washing stand should have: the paper towels, the water, the bucket to catch the water, some sort of soap. Doesn't have to be any sort of antimicrobial business, whatever, just some soap, and somewhere to put the paper towels. Signs to remind people to wash their hands are always a really good idea. I feel like people have gotten more familiar with hand washing right now, so maybe it's kind of more run-of-the-mill now. Sanitizing the surfaces and tools. Now, before I told you that surfaces are not the primary ways that the disease is transmitted, and that's probably true, but there's a lot we don't know about this disease that epidemiologists are learning every day. And so out of an abundance of caution, it does make sense to clean and sanitize, especially those high touch surfaces. So the gate handles, the hose sprayers, any of the shared tools, things that multiple people are touching. Think about just spritzing those down with a bleach solution or using a wiping sanitizer. If it is a food contact surface, if it is a tote that you will be putting produce in, you should take caution in the type of sanitizer you use. Don't use your Lysol bathroom spray on that, because that spray is not intended for a food contact surface. It's going to leave a residue, and it has fragrances and some other things in it. So if you look at the label, and you always have to look at the label, that Lysol bathroom spray is going to say, if used for a food contact surface, it must be followed by a freshwater rinse. So I just like a plain old bleach solution. Put a tablespoon or a little bit less of water, of bleach, into a gallon of water. Stir it around, put it in a well-marked spray bottle, and you've got your sanitizer. Works well. So I do have to say, you can't sanitize a dirty surface. So if you had a really dirty tool or something, you would need to clean that off first and then spray it. And of course, as you know, this is very good for plant disease as well, for the minimizing plant disease spread as well. So for scrubbing, or first written on, this would be like a table. So get rid of all the visible junk, and then you're scrubbing it with some soap occasionally, spraying it down with some water, and then spraying it with that sanitizer. I'm not saying every surface has to be scrubbed with Dawn soap every time, but occasionally I would scrub down my totes and my other things that I'm putting my food into, just like I would wash my plates. I wouldn't just rinse off my plates for a season. So some other just ideas about some of those high touch surfaces. I would also write this down if I were you. If I was I work with a number of farms that have like an incubator farm, for example, and there's many people using the same space. Anytime there's a lot of people, it gets really complicated, right? Who did what? Did you clean it? Did you not clean it? If everyone has their own tools, then that's fine. You don't have to write that down. But if you're sharing things at all, I would definitely have a log of what was done and when. So if you're sharing a table and you're using that as your sorting table to put tomatoes directly on, I would have a log hanging in the shed if I had that said what was done to it. It's just nice to know. So the EPA has created this list N, which is the approved sanitizers that are approved for use against SARS-CoV-2. Like I said, it is actually a pretty weak organism, and it's easily inactivated. There are many, many, many things on this list, like over 400 sanitizers. Bleach is on there. There's many other things. This is an example of it. If you don't like bleach, there are other options. The Sanidate that I listed is an option that a lot of farmers use if you're not comfortable with bleach. Face coverings are absolutely recommended. If you are the only person in the garden, you probably don't need to wear a face mask. If there's someone else there, I would wear a face mask, especially if you are kind of coming closer to each other. But remember, when you wear a face mask, it's not preventing all of the droplets, so you do still need to maintain that physical distancing. Wash the masks, and then don't start putzing with them. They're kind of uncomfortable, right? I know. But don't, if you find yourself touching your face more, you really got to stop. The other option is a face shield. Many people are starting to wear the plastic shields, and that's totally acceptable. You could wear those too. I just want to point out some resources. This might not totally pertain to you, but the Department of Ag, I work very closely with our Department of Agriculture, and they have been creating a lot of guidance on COVID right now for people. And so we've created this preparing agricultural workers for COVID-19, and some of the information in there might pertain to you. I'd be happy to send out these links to you. But I did want to just say that however you plan when you open up again, have that open communication. So have a plan. We, my colleagues and I on our HORT team, Natalie Hoidel and Annie Claude and myself, developed this garden food safety plan, or COVID-19 response plan. We also have one for farms. So it's a template that you can update to be reflective of your own policies. Use it as a way to prioritize those risks so you don't have to think through all of this. It really just reiterates what I've said today. And then have training on your policies when you start to gather up again. So that middle picture there is a snapshot of our community garden response plan template. Bottom left is we just released some new videos about COVID, just the basics of how the disease transferred, best practices on the farm or garden to reduce transmission, best practices about masks and gloves, kind of the stuff that I've talked about today. On the right, MDA has created a guidance for community gardens that if you haven't seen, I would be happy to send out that link as well. So that's it. I will just say, going forward, when you seek out more information, I know that I am preaching to the choir here, but just really reaching out to trusted public health institutions. There's a lot of misinformation out there, unfortunately. A lot of kind of do-it-yourself, mixing up different sanitizers or taking different things. You know, if you're finding it on YouTube and it's just kind of not in the mainstream, I guess I would be wary and just do your research. So that's all. I guess there's probably some questions I've seen come in.
Thank you, Annalisa. We do have a few questions. Janet was asking about if you could explain water testing again.
Sure. Yep. So that's not COVID related, but I'd be happy to. So if you are on city water, which I'm assuming most of you are, you do not need to have that water tested. So municipal water meets EPA's Clean Drinking Water Act standards, you're good to go. I would think about my water distribution lines. I would think about my hoses. Occasionally trying to dry out hoses. Hoses have that biofilm, that slime, you know, think of like your dog's water bowl or your fish bowl. Or your teeth, if you don't brush them enough, gets biofilms build up. Biofilms can trap bacteria very well. They've been shown to do that. So hoses, do your best to occasionally dry them out, of course in the winter, but then sometime throughout the season, I would think about that. Try to get them up off the ground. But municipal water does not need to be tested. If you had well water, you would want to test that annually for the presence of generic E. coli that would indicate fecal contamination.
Tim had a question about sanitizing garden tools and gloves, but I kind of think you've kind of covered that in quite a bit of detail. Tim, was there more information you wanted about that?
I didn't mention gloves. That is a good point. If you're using reusable rubber gloves, so of course there's many different kinds of gloves. We got disposable gloves that are meant to be disposable. If you put those on when you get to the garden, wash your hands, put them on, and then change them as frequently as you would wash your hands. Take them off before you go to the bathroom, change them. Take them off if they get dirty or torn, change them. If you're using garden gloves, cloth gloves, launder them occasionally. And if you're using rubber gloves, you can definitely wash those off and spray those with the sanitizer. Try to let them air dry between use.
The other question was, do you think the recent protests will increase transmissions? Do you think we'll see a spike in new cases?
Well, I'm not an epidemiologist, but yes, I mean, it sounds like the epidemiologists are saying yes, it unfortunately probably will. I personally saw, I think, a lot of people with masks on at the protest, but also people without. And they specifically said when people are shouting, when people are passionate, it really has been shown to increase your droplet spread. And people are also very passionate and perhaps taking off their mask because they feel passionately about what they're saying, which is very understandable.
Were there any other questions for Annalisa before she goes? If you don't want to type it, if you just want to jump right in, you can unmute yourself now since also, just to let everybody know, tomorrow I'll email out a link to this recording, and then also I'll include Annalisa's PowerPoint in it so that if you didn't get a good close enough look or whatnot, you'll be able to look at it, you know, right up in front of you. I know that can be a little sometimes.
And so I kind of, this was a COVID presentation that I kind of talked about good agricultural practices, but I would be happy when we get maybe back to normal operating to do more of a presentation on those good agricultural practices, because those are more broad. They apply to everything in the garden, to everybody growing fresh fruits and vegetables all the time. So we have, I do primarily work with kind of those commercial growers, but the same principles apply. And I know that Christy and Jackie are creating a lot of, and Anne, my colleague, Anne Sawyer, has worked on creating some modules for master gardeners as well. Anne is a master gardener as well. So those should be forthcoming.